The Eastern Cape, the health department in that province, has also been in the spotlight with reports that it's drowning in debt. The Rural Doctors Association says the provincial department is in crisis. Let's take you live now to Bishu Hospital. eNCA's Sandy McCowen is standing by to talk to us. Sandy, I understand, with a senior representative from Eastern Cape Health.
Yes, I'm sitting here in the heart of the health department, the hub, where all the decisions are made. We are in Bishu, in the head office of the health department, and I am joined by the Superintendent General, Dr. Tubile Mbengashe. Thank you so much for joining.
Thanks,
I really appreciate it.
Thank you.
One of the things that has been said is that the Rural Doctors Association say that the department is in crisis because you're grappling with a 17 billion rand debt due to the medical negligence claims. What do you think?
I think just to thank you for the opportunity. The 17 billion is called contingent liabilities. These are really the claims that have been made against the department. And these claims can be actualized or not been actualized. And one of the biggest things that we've actually done is to take the 2,000 claims, took it to the forensic to really look into them. We've actually found that 600 of those were actually duplicates. So that's number one. The second thing is we've got an expert teams that actually, expert lawyers who have looked into these. In their first batch, about 200, they found about 60 or so cases they actually did not meet the requirements for actually the application. We have a SIU which is actually looking in terms of the fraud and issue like that. We've got about 12 cases where really it's very clear that a child was not ill and there was no claim and the person wasn't there. So we do believe that there are genuine cases of cerebral palsy. There are also fraudulent cases of cerebral palsy. So we're doing in a number of strategies. One, there's a very clinical strategy. We are very lucky because what the national provincial department, last year they gave us 317 million just to get the staffing that's required. We have now appointed 1,800 nurses, including doctors and other people in 26 hospitals that are really the biggest one that are actually going in. In the next medium-term period, we'll be getting 689 next year. By the end of the MTF, we've got about 2 billion just to really respond to the medical legal.
Talking about doctors, I was speaking to some of the officials who are saying it's very difficult to attract specialized doctors into this area, specifically into the Eastern Cape.
No, that's true because the distances are quite far. Our cities are very small. The amenities do not exist, and most doctors are usually young people, young families with children. What we're really trying to do is really to expand the capabilities of using the centralized hospitals. Now we're using a lot of technologies to match the distances. So we have got now Sandy McCowen, which is linked up with Butterworth and other hospitals, and that's really where we're trying to close the gap. So it is now going to be possible for a doctor at Sandy McCowen to make a diagnosis of somebody around Mkanduli, SCHC, to actually provide this. The second one is really we have found that accommodation is important for doctors to make really their places to be. We're investing in providing accommodation, but we're also investing in really making sure that they have these other things that they require in terms of allowing for training. I mean, we've got about 20 young doctors now who are doing additional training with universities, diplomas and everything. We think all those interventions are really going to be. But what has been very important is to restructure our services for maternal services. We have identified 26 hospitals. These are going to get new equipment. They're going to have the ability to monitor moms. They're going to be able to have the ability to look after the little ones. And they're actually going to have the level of services that they are. The other smaller hospitals now are going to be really trying to push their people into that. We're also bridging up with the ambulances as well.
One of the things that the Rural Doctors Association are saying is that they're working in untenable conditions. They say they're in these rural hospitals where they're understaffed, they're under-resourced, they're under-equipped, there's no medicine. They say there's a problem with the Mthatha depot to get the medicine to these very, very far out rural areas. What is happening with the hospitals?
I think there is a part of a delay and a lag in many of these, because one of the things we realized, I mean, in the last 5 years, this is one thing that we've actually realized. We realized that if you don't have medicines on time and actually available, we now have what is called a visibility system, where every clinic has got a code to order themselves, but we also have a very useful app that is able to ask every nurse, every clinic to go up and take their stock, and we actually know. I can get in my phone now to know what is the level of stock, which hospital it is. Mthatha Depot, we're totally revamping it. We've actually brought new leadership. We're actually working it through now to make sure that it meets the requirements. We actually have been using one of the systems which in the NHI is called the Central Procurement of Medicines, where we have found that most of the patients come to our services for repeat medicines. We're delivering those medicines at home. There has been an extraordinary change. I mean, if you look about 5 years ago, our budget for health service was around 17 billion. Last year it was 22 billion. This year is 23 billion. So there's a gradual increase. We've moved from having the provincial budget from about 27%. We're actually now at 30% of the provincial budget. So there's been a very concerted effort to respond to the need. And I think people were right. There was a time when we didn't have medicines, but really now you can hardly find a hospital without medicines. There was a time when we didn't have equipment in hospitals. In the past 2-3 years, we've actually made sure that every hospital has got the essential equipment, and we're really building up on those critical emergency services as well.
You were talking about the budget, and we were talking about the negligent claims. The negligent claims at this stage are sitting at a very high mark. You did say that, that it would be brought down, but is it still not going to affect service delivery in the province due to the fact that you still have to pay quite a huge amount for these negligent claims?
Just to give you a sense, I mean, this year, as it ends now, we've paid about 381 million on claims. That's a huge amount of money, because government, in terms of the state liability, does not really budget for that. But there are really new ways that we're responding to this. One of them is really to make sure that there is a provision of the medical claim, and the budget for that is not taken from the government budget.
Sorry, Dr. Tobile, I have to leave it there. I'm really sorry. That was Dr. Tobile Mbagashe speaking to us from Bishu head office for the health department.